Hi, I'm Kyron at Body Escape Massage Center in Columbus, Ohio, and I wanted to have a little discussion about force vectors and how it relates to exercise, namely strength training and flexibility training. Strength training, most people know as weightlifting, high intensity interval, CrossFit, those types of things. And flexibility training could be yoga, Pilates, um, just stretching in general. One of the best examples, I think, to illustrate why it's so important to know what force vectors are and how it relates to your exercise is in an exercise that I've seen for years. It's really common, and a lot of people I've seen do it have their reasons for doing it, but I wanted to outline why it isn't necessarily as beneficial as other exercises might be for what area people are trying to target. And this is a strengthening exercise that people do. All of us have probably seen an individual, maybe you yourselves have done it, where you'll hold a dumbbell in each hand or one dumbbell in one hand, and you'll lean side to side like that. And that's core training, right? Sort of. Core training, what people usually refer to as abdominal training or core training, is actually two different things. Core training, for the most part, does not isolate your abdominal muscles, which is what a lot of people want to target, and instead works primarily your hip flexors, quadratus lumborum, and your spinal erectors. If you're trying to target your abdominal muscles, this exercise, you could do a lot better than this exercise. And the reason is, and I'll explain, is your force vectors. I have a little way of demonstrating that. Force vectors are the direction that your muscles pull on a bone to allow a movement in a certain direction. So if we're moving this way, we first want to identify what that movement is, and we'll call that lateral flexion. Lateral flexion of what? And this is where the joint comes in. Lateral flexion of the spine. Lateral flexion of the spine in the lumbar region. And as some of you may or may not know, the abdominal muscles do not attach on the spine, nor are they a prime mover of your core. So, what are the muscles that you're working when you do this strength training exercise? Well, if we use our force vectors, we'll be able to find out. The abdominal muscles, you have four of them. Rectus Abdominis, which are the ones on the front of your body. People usually refer to those as six-pack, if you can see them. Those bring your ribs closer to your pelvis. You also have external obliques, which run from the lateral ribs to your rectus sheath, which is if someone's really lean, you can see an outline around their abs. That's where the external obliques stop. And they run in a diagonal direction from the upper portion towards your rib cage or armpit down towards your umbilicus or your belly button. So that direction, you have this direction and that direction. You also have internal obliques, which are kind of the little brother or little sister of the external obliques. They run in a diagonal direction, but they go from high to low backwards. So they attach on the sides and go back down towards the sides of your waist. And last, but certainly not least, the transverse abdominis. And those are what people usually say is their love handles if they have a lot of adipose tissue on them. Those muscles are like, if you can imagine having, I refer to it as an onion ring. If you have a really thick onion ring and you chop it in half and then stick those on the sides of your body. So they're going to come from here and attach to the front of your rectus sheath in the front. And those muscles, knowing what direction their fibers orient in, can tell you what they do. Just like I said, the rectus sheath brings your ribs closer to your pelvis or your pelvis closer to your ribs. External obliques rotate your ribs towards your pelvis on an isolateral direction. They also help with lumbar flexion in a unilateral direction, bilateral direction, and your external obliques rotate your ribs away from your pelvis. So if I'm going this direction, external obliques are pulling on this side, internal obliques are pulling on that side. Now the rectus abdominis, which is what a lot of people believe that this movement targets, your love handles, those muscles have a horizontal fiber orientation. So what they do is pull this way. I'll just hold it like this and make your muscles shorter like that. So what they actually do is pull your stomach. If you're pushing your stomach out, the way that you're actually able to pull your stomach or flatten your stomach in is because of the transverse abdominis. So reviewing, this type of motion, none of the muscles in your core, based on their fiber orientation and therefore their force vector, are a prime mover. They will help stabilize, but what you're going to be working most of all is your spinal erectors, quadratus, hip flexors, and even your lats in some instances, depending on how heavy the weights go. So, force vectors. If my core is being pulled in towards my spine, then the force vector is that way. That's the fiber orientation. If my ribs are being pulled towards the opposite side of my pelvis, a downward diagonal or an upward diagonal, that's the force vector. Opposite for the external obliques. So you can see that the external and internal obliques, there's more of a twisting motion, which is what people, when you see them doing twisting crunches, those do activate the external and internal obliques a lot. Transverse abdominis, nope, just this. So any exercise that's not causing you to flatten your stomach is not going to rely on the transverse abdominis to be a prime mover. You have to know what direction the bones are being pulled in versus the weight that you're using, and that's what's going to give you your force vector. Some good abdominal exercises that you can use to train those would be crunches, side crunches, reverse crunches. There's not going to be a whole lot of movement in your core. A good rule of thumb that I like to discuss with people, and one that I use myself, is if you can move it while you're standing, that's about all the motion that you need to train your abs in isolation. Your abs are going to assist with a lot of different things, but they're not going to be a prime mover in exercises such as this one. If you want to work your lats, if you want to work your spinal erectors, quadratus, and hip flexors, that's a great exercise. Otherwise, talk to your personal trainer about giving you a different exercise that's going to isolate your abdominal exercises more. Don't forget to like the post and subscribe to our channel for more tips. This is advice meant for people who have the medical clearance to engage in exercise, and it should be taken as informational purposes only. Thanks. We'll see you next time.